In our Living Well segment today, nearly 1 in every 6 men in America can be expected to be diagnosed with prostate cancer in his lifetime.
That's right, but the good news is when it's caught early, it's very treatable.
And that's why awareness is so important. Today we're joined by Dr. Brian Lane of the Spectrum Medical Group to share information, what we need to know to keep our dads, our husbands, our sons healthy. Thanks so much for joining us today. Why is awareness so important when it comes to the prostate health?
Well, thanks for having me. It's so important because when we catch this cancer early, it is almost always treatable. Prostate cancer, as you said, is the most common type of cancer in U.S. men, and there are still men who die of this disease despite the fact that we're looking for it. We're doing a great job with screening. We're treating it early, and some men still are dying. So it is important to look and to look early because the best chance for a cure is to catch it early.
And we hear that repeated over and over and over again, and again, as you said, still men don't go in for those screenings. At what age should the prostate screening really begin?
So this really is a new thing that the American Urologic Association has changed, which is to start recommending screening from the age of 40. Up until about a year ago, the age of 50 was when we were recommending it. And the reason why the ages come down is because the screening test, this PSA test, is a better test in younger men. Before the prostate starts to grow, before we have all these difficulty that bring men to the urologist's attention, that's the best time to really see if this blood test is off and if there's something to be concerned about.
Because the PSA measures what?
It's a reasonably non-specific test. It measures that something's going on in the prostate. It can be elevated either because there's cancer. It can be elevated just because the prostate is growing.
Okay.
And so again, it's important to test it before the prostate starts to grow because that really gives you a good idea, if it's up, that something's wrong.
All right. Okay. Why don't we take us to the diagrams and just kind of give us a little bit of anatomy 101 when it comes to the prostate.
So the prostate gland, it lives deep in the pelvis below the bladder. It's something that wraps around the tube through which the urine comes, and it's in red in this diagram. And when prostate cancer is detected early, these little black nodules you see in the diagram would represent the cancer cells. They haven't spread outside of the prostate gland. This is a great time for treatment. A single treatment works, and sometimes we even hold off for a while before we recommend treatment be given. And that contrasts significantly with the next diagram where if we wait, the prostate cancer cells can grow and then they can stick outside of the gland. And you see that here. You see a more aggressive looking gray and black, more ominous appearing cancer cells. When it gets outside of the prostate, that's when we're more concerned, and these are the patients who are at risk of dying of their prostate cancer. So screening helps us to catch it early before the symptoms arrive and before the cancer is outside of the prostate.
Because if you catch it when it's contained, it really is just treating that prostate.
Correct, correct. And all the best treatments for prostate cancer and for early detected prostate cancer focus right on that gland. You don't need to have additional treatments that would affect the remainder of your body. They all are focused on that gland.
Okay. Now what about those kinds of individuals that should definitely make sure they're screened? I mean, you're talking about universal screening starting at age 40, but what about if you've got a family risk history?
Right. So family history, we know, is a significant predictor of developing prostate cancer. And so when you have someone in your family, then you're definitely the one who we need to get in and screen by 40. And we use a lower threshold usually on that PSA test to recommend further testing and to get a biopsy. Men, you know, everyone who's 40, I think, should get an initial PSA test, but for sure, if you have a family history, you really need to come in.
Now you're saying at the age of 40, men should really start coming in and getting this test. Now, is this once a year testing or every few years?
It's a great question, and so there's a lot of controversy around that topic. There's definitely information out there that initial test predicts your long-term risk of cancer, whether or not you have it every year or every 5 years. It's that initial value that's important. So I happen to think screening every year, if it's normal and low, may be overkill. We may really be able to decrease the amount of screening that we do. But again, we need to get in at least the first time and then make a plan with the primary care physician about how often to screen after that.
And there's so much information, and it really changes as the research becomes available, and especially as doctors like yourself and the doctors in your group are on the cutting edge with technology. And so you have a special event coming up on Thursday. We wanted to share that information with people.
We do. So on Thursday at the Lemon Holton Cancer Pavilion, we will have the Da Vinci robot available for anyone in the public who wants to come down to see it, to test drive it. And then also many of the people in town who are the urologic surgeons who do the robotic surgery will be there to answer questions. I'll be there in the evening to answer questions and give a presentation about options for prostate cancer care. And it's a field where there are a lot of opportunities and a lot of options. Each person needs to make an individualized decision about what's the best for them. So it should be a good event, good opportunity for those who are interested to come
A great
by.
way to ask questions and just to engage with that information, especially if you're nervous, if you don't have a lot of access to, you know, a healthcare provider who you feel comfortable asking those questions to. Thank you, Dr. Lane, for joining us today.
Thanks for having me.
Yeah.
We'll have all that information on our website as well. We'll be right back.
That's West.